What to do after you've received your functional neurological disorder diagnosis, depending on where you received it. Hi, I'm Dr. Julia. I'm a licensed pediatric psychologist. I work a lot with kids, teens, and their families who receive an FND diagnosis. It can feel really overwhelming to know what next steps to pursue after you receive the diagnosis, especially if you're discharged without a follow-up plan. So if you're diagnosed in the emergency department, often they will refer you to outpatient neurology unless they had a neurology specialist or designated person who felt really confident in their ability to diagnose FND. If you did not receive an outpatient neurology referral, you can request that be done, especially if the emergency department that you are in is through a big hospital system. So a lot of the kiddos that I see, even if they've been diagnosed with FND in the ED, they will then be referred outpatient, or they'll be admitted to the floor, complete neurological testing to determine appropriate diagnosis. So if you are in the inpatient setting, let's say you're on the floor and your child receives an FND diagnosis, usually that means they've done a bunch of other tests. A designated specialist, usually a neurologist, has seen your child. They can consult psychology and physical therapy, both inpatient, whether that's the consultation liaison psychologist or a designated FND psychologist. It depends on the hospital. So some psychologists will do just inpatient work. They'll kind of do the initial treatment with you, and then you'll be discharged and you'll do outpatient follow-up with an outpatient psychologist, but they'll help you coordinate that care. Or you will see, like, I am the designated FND person along with a couple other people. So one of us will go see the consult, and then one of us will just keep following you once you're outpatient. If you are seen in an outpatient clinic, most likely you are already going to be seeing a psychologist in parallel. Sometimes we get referrals to neurology and to psychology at the same time, unless you don't have the FND diagnosis yet, in which case the neurology outpatient will place a psychology referral. You can ask for specialist referrals from your physicians. So you can explain that you've seen that the most evidence-based treatment is multidisciplinary for FND, which is true, that psychology and physical therapy are major components of treatment. Regardless of where you are seen, you can request that referral be placed. You can also contact your your largest or biggest hospital system in your state, and usually many hospitals have designated psychologists for FND. We are specially trained. That is just what we do. It's our bread and butter. So that is another thing you can request. You can contact them yourselves, but they will usually request a physician referral, though not always. Let me know if you have any questions about that system. It is kind of messy, but again, you can always request a referral.